From Accra, Ghana to Atlanta, Georgia comes Majid Michel, the first African celebrity to visit MedShare and become an ambassador to the cause. A promising effort by his US management team to reach out to his own people and more. Today, a philanthropist goes to work at MedShare.
Hello, how are you? Good, like you, 100%. How you doing?
After the pleasantries and the warm exchange for all the right reasons, it was time to save a life at a time.
We're super happy that you're from Ghana, because Ghana is one of our major partners in terms of Ministry of Health, as well as some of the faith-based hospitals. And what we do is we collect unused medical supplies from hospitals and brand new medical supplies from manufacturers. And we also collect largely used medical equipment and refurbish that and ship it to needy hospitals around the world.
And here's proof.
Now, this is a dock door, and this truck is obviously ready, loaded. When it leaves this dock, it's headed for the port, and somebody's life is definitely going to be touched and saved wherever they might be. And for the contributions that MedShare is making here in the United States and reaching out to patients all across the world, we couldn't ask for a better review of what they're doing here. So.
For Majid, this is encouraging and was ready for more. To the administration for an experience with the men and women dedicated to saving a life somewhere. Suddenly he was seeing firsthand the actual efforts of doctors like this one.
He's gone to Haiti on 2 occasions in medical missions and has done 15 surgeries there. He also trained some of the doctors in the rural areas to do minor surgeries where there were no surgeons. And he's traveled to most of the regions of Ghana and worked in a few of the hospitals there. And he also recently was in Nigeria helping the Nigerian medical staff know the difference between the British items versus the U.S. ones, because there's some slight differences.
Yeah.
And docteur, ça c'est le grand acteur de Ghana. Tu connais? Oh, ok, c'est bien.
La figure,
Ah bon.
que je connais celui-ci.
I was telling him who you were. He already knows who you are, right? Yeah, so.
Je vois les movies.
Yeah.
Je l'ai vu, ça c'est celui-là.
Oui, c'est lui.
Ça, c'est-
Good to see you, doctor. Good to see you. Well done.
Thank you.
God bless you.
Thank you.
And,
Thank you for coming.
Such a doctor, so selfless, it makes you want to do more. And that was Majid's next question, just how to reach someone in need anywhere.
They have barcode labels, and they identify it by a number that is on our inventory on the website. So when you're ready to order, we give you a password like eBay. You go in and you select the things you need. But we ask that it's a medical person so that, you know, they get the right things for the hospital.
Just him getting involved raises awareness, right?
That's the
And that is so
thing.
important, because
Right.
even if you can just let
People know.
resonate MedShare,
Right.
because you don't know what MedShare is, okay,
Right.
well, now you know.
Right. So most of the things, the expiration date, are much bigger. And we have a second warehouse like this in California where we do the same. And we're opening soon in New York and possibly in the future in Florida.
Next up is the biomedical department with plenty of surprises.
Stop. What's going on, man?
How are you?
Good to see you at
Good to see
MedShare.
you. Good to see you.
It's just like a surprise.
You're from Cameroon?
Yeah, I'm from Cameroon.
You look like DJ Chick, one of my friends.
So Eben is our director of biomedical engineering. He has a master's of biomedical engineering from University of London, about 17 years of engineering experience. And he's also Mr. Pepe Kale of Cameroon. He's a performer, and so he does a lot of concerts, etc. Write his own music, etc.
Wow.
Hey, man, you know this guy?
I know this guy.
You know, when I went
He's
to
too
Ghana,
excited,
yeah,
right?
I'm too excited because to see him. In fact, we've not got an icon like this from Africa who's come to MedShare. You
Right.
know, an actor. Have we
Right,
not had any?
no,
No, we've not had any.
right. This is
Since
the
I've been
first
here for
time.
about 6 years or so. So I'm.
Wow.
And this is
Yeah.
Mr. Tesfa. Tesfa is #2 in the biomedical engineering program. He's from Ethiopia.
Oh yeah.
And he dances.
Among other things, their achievements collectively left us in total admiration of their efforts.
He nominated Eben for the Biomedical Engineer of the Year for the Georgia
Congratulations.
Society. He got that. He was nominated again the second year, and last year he was recognized by an International Society of Biomedical Engineering for his work in Honduras, Guatemala. Where else did you go in Latin America?
CNN hero.
Right. Yeah, exactly.
Coming up is the belly of MedShare.
We're now in the warehouse, the holding section of MedShare, with an elaborate plan to ship all these medical supplies. Most of them have come straight from the manufacturer because perhaps they had small little dents or damages and they just chucked them. So what MedShare is doing is picking them up and rationing them appropriately to most areas in Africa and of course Asia as well, and other deprived areas to feed the hospitals out there and to basically help and strengthen and improve the lives of people and patients out there in these hospitals. So it's an elaborate plan again for MedShare to continue with this. So this is the facility. As you can see, all these flags up there represent every country that they have shipped to, and it's continuing and it's going on. So we'll be getting to other areas and we'll be showing you more of what MedShare is all about.
At this point, it's a certain spirited feeling out of all the participants, seeing what little is possible at a time.
CJ.
Yeah, I told him.
Yeah, tell
when
him.
I seen him, I told him that me and my wife had movies, and every preview we see. So yeah, he's like the Denzel over there.
And I guess for his fans, you could say it's fun time.
20 of these individual stacks go into a 40-foot container. This is one.
Okay.
This is one.
So here, 1, 2, 3, 4, 5. So this is just 10. They still have
So they will
another
have another 10 here and
the container?
one container.
But there's a patient somewhere calling. We're now treading in search of a definite answer to improve general health and a much closer look at all the possibilities with MedShare.
This is Tesfa here, one of the engineers with MedShare, responsible for the biomedical department. They actually make sure that some of these equipments are actually even fixed for the use of hospitals across wherever they ship these things to. So tell us a bit more about what you do here.
Yeah, as you can see here, we have a lot of biomedical equipment. Of course, these equipments are used, but before we shipped them, we evaluated them, we checked everything. Unless it is on the standard of the United States, we are not going to ship.
Okay.
Of course, it might be used before. So what we are doing is we evaluate the equipment. We will gather all the accessories, and if as needed, we will bring also the manuals, as a digital or the hard copy. After we gather all this, we will send the items we have to the person. We'll send the spreadsheet. They will see what we have based on the capacity of the hospital. They will pick what they need.
Surely glad to know, and you cannot deny, that this is a worthy cause.
You see, we're in the facility. This wheelchair right here is going to somebody in desperate need of care, you know what I mean? So it's just beautiful to see that they have kind of all of the equipment, everything kind of packaged and categorized and ready to ship to the motherland and to just people in need, you feel what I'm saying? So what we're doing today is just kind of just showing Majid and Paul and the whole team, Reggie, just kind of having that meeting and just getting to know what the whole MedShare plan is about. So we're just projecting this for the world to kind of just see and just get a glimpse of what's going on, man. Quickly introduce introduce you to two important executives here who are very industrious in what they do, and especially making this whole Majid tour happen here today at MedShare. Mr. Erawoc, you want to?
Of course, I mean, we're just happy, we're glad that Majid was able to be given the opportunity to come and look at what MedShare is doing. And we are happy that we'll be able to use our celebrity to get some things going down to Africa and create some influence in the hospitals and help people back home. You know, Matilda?
Yes, and this is amazing. Majid will be the first actor to have even been here and start a project like that. So we look forward to working with him and making things happen for us.
Thank you very much. We'll see you on the healthy side. World-renowned international screen sensation Majid Michel, who was today invited to this place so he can become an ambassador to promote what this facility is doing. They send medical supplies all over the world to deprived hospitals and so on and so forth. So talk to me about your experience here today. And
well, it was really fantastic, you know, same time a bit emotional and touchy. In correlation to weighing what I see back home and what I saw here, if I give you certain examples, very simple example, like 4 kids in the hospital sharing one mask, and then I'm downstairs and I'm seeing 7,000 masks, 7,000 masks, and I see 5-6 kids sharing one mask in a hospital in my country. I'm responsible for this. What am I supposed to do? I think I just have to solve the problem. I think, well, I can't do it alone, but I'll try as hard as I can. So I'm really here at MedShare to work with them and see exactly how we can make this work in Africa and supply as many containers as we can just to solve the problem.
right. Well, one of the things that they're really excited about is the fact that you're the first screen icon to visit this facility, and it's important for them for you to project what they're doing here. So what are you taking back?
Yeah, well, you know, I think it's a great idea. I mean, most people that have been here are heads of states and presidents and vice presidents and ministers and things representing different countries, and I'm the first actor actually to be at MedShare. And well, it's a great platform. You know, I'm really going to put a word out there. I have loads of interviews, you know, every single day of my life, and just talking about this at least for a minute in any interview I have is going to put it out there, and it's going to bring more awareness about it, because people have no idea. Well, I didn't have any idea till now. So that's exactly what I'm going to do, you know, talk about it in most of my interviews and put it out there for everyone to hear and have experience about MedShare.
So yeah, we're making a practical approach now to affect the lives and impact their lives positively. Today, I strongly believe that having seen what these people do here, a patient somewhere is going to get better, and it's all about, you know, transformation and helping lives, save lives.
Exactly. And MedShare is about everything from gloves to syringes to machines to anesthesia machines to everything medical is what they do. So we'll just really push ourselves to the wall as much as we can, just to make our countries and other countries, neighboring countries, have these facilities to enhance the hospitals and anything healthcare.
Paula Shatir reporting from the MedShare facility in Atlanta with world-renowned big screen sensation Majid Michel. Thanks a lot.